Ceramides. So those of you who don't know what ceramides are, they are essentially sort of fatty acids or lipids as we call them. They contribute a lot to our skin in terms of composition, and what we find over time is that ceramides decrease. Hello and welcome to another weekly newsletter with me, Dr. Sunny Dhesi, a GP and aesthetic doctor and wellness doctor, also specializing in women's health. So what have I got in store for you for our short video newsletter? Well, we're going to talk about ceramides today. These are the mortar, the binding in between our skin cells, which are the building blocks for our skin. And I'm also going to give a little bit of a roundup in clinic and also talk about some combination skin problems that we have encountered in clinic. So thanks for watching and keep tuned, and I hope you enjoy this weekly newsletter. Ceramides. So those of you who don't know what ceramides are, they are essentially sort of fatty acids or lipids as we call them. They contribute a lot to our skin in terms of composition, and what we find over time is that ceramides decrease. But what it means is that if you consider that ceramides are the mortar in between bricks, and the bricks are our skin cells. So if you want to have a good structure, obviously you need bricks, which are skin cells. However, you need the mortar between them as well to keep those bricks bound. Now, our skin is a very fluid and dynamic structure. It's not solidified, I should probably say, like bricks. But without that mortar in between, then what happens is that we get slipping and sliding, we don't get as good structure. And how does that manifest in how do we look? Well, it appears as, dull skin's not as glowing, it's not as radiant, and it doesn't matter what you do, it doesn't matter how many times you exfoliate or do anything else, the skin just doesn't restore back to how you want it, that youthful glow, that radiant glow. So lots and lots of products contain ceramides, and ceramides come in different shapes or forms. But what you want to do is look for a moisturizer that has a high content of ceramides or talks about ceramides in its actives list, and applying that twice daily, morning and night, preferably after a serum, will help to restore what you're losing. So that's the importance of ceramides. I just wanted to keep it nice and short and quick for you. So next time you're looking at products we can recommend, for example, I have one just here, our Salvation Balm. I was going to say a little pocket rocket that we talk about. This has a ceramide called Sphenox Lift. Now, what's great about the ceramides in our Salvation Balm is that not only does it provide that content replacement or that mortar in between the bricks, but what it also does is it helps to improve communications between the skin cells. So imagine you've got a substance that can communicate in between. A good way of describing it would be like an orchestra. So an orchestra that has no conductor would sound awful. But if we have a conductor conducting the orchestra, then what we have is a cohesive and great sounding music. The wind section will be communicating effectively with the string section, the piano, the trumpets, etc. I always can tell that I'm not great at describing orchestras, but that's a good example. Sphenox Lift is a good example of a really active ceramide that really helps to restore that glow and radiance to your skin. I hope that helps. I hope that was interesting. If you've got any comments, please do comment in our YouTube channel or on wherever you see this on social media. Clinic and what patients are coming in with. And we've had a lot of inquiries or on our virtual consultations about combination skin. And one of the things that I've mentioned before that patients get a little bit confused about is my skin dry? Is it dehydrated or is it oily? Now, for a lot of our patients who are women, we find that oiliness tends to creep up in the latter part of the menstrual cycle. Obviously, perimenopausal or menopausal, then that cycle can be a little bit chaotic, and that's why you get oiliness maybe throughout the month. You never have that clear period. Dehydrated skin is, for example, when you come out of the shower and your skin is feeling tight and sore and it's sort of crying out for moisturizing. We've just spoken about ceramides. That's the perfect opportunity then to have a good moisturizer with ceramides in it. And dry skin is when your skin is itchy and flaky, and that can sometimes require a little bit more intense treatment, whether with balms, whether with occlusive moisturizers, or if you speak to a healthcare professional about prescription treatments as well. Obviously, this doesn't constitute medical advice. If you do have any problems with dry, itchy, flaky skin, it's sore, it's red, it's irritated, then you may need to have a consultation with your physician or healthcare professional. So we've been seeing combination skin, and what we're finding is that Sometimes it's a secondary to dehydrated skin, or it can be sometimes due to overexfoliation. Now, the time is coming in now when you can start to increase your exfoliation, but with one patient, for example, we found that they were isotretinoin, so that's retinol. They'd got some azelaic acid, and in combination. And what happened is they started using it twice a day. That over-exfoliation kind of pushed their skin into a more dehydrated state and irritated state. And then what happened is that it was red and sore. What we needed to do then was calm the skin down and restore the barrier function by using combinations of cream-based cleanser, serum, and moisturizer. I mean, if you've got any concerns at all, we have our virtual skin consultation service. You can also fill out the questionnaire and get access to our virtual skin analysis tool as well. So that is a roundup. This is a short newsletter this week, a busy clinic to get back to. I hope you've enjoyed it. Please do feel free to leave comments. And if you haven't already subscribed to the YouTube channel, please do, and hit the bell for notifications. I'm Dr. Sunny Dhesi. This is Vysana Life, and I hope that you are finding these weekly newsletters useful. Thanks very much for watching.